Hi guys, welcome back to my channel. If you're returning, thank you for coming back, and if you're new, welcome to the family. My name is Pearl. I post videos every week about nursing, medicine, faith, and lifestyle. In this video, I want to talk about what you should expect when you do your nursing school clinical rotation. So if that's information you're interested in, then keep on watching. And for those who are new, again, thank you for joining the family. Please don't forget to subscribe on your way out, and let's begin. So this information is based on my experience in nursing school, but I also did some research and found that most nursing schools have a similar schedule. They always try to schedule your clinical rotation based on what classes you are doing at the time, just so you learn it in class and then you practice when you're at the hospital. But the different rotations will be Foundations of Nursing, MedSurg 1 and 2. There is an OB rotation, there is Psych, and I think those Peds. I believe those are the main ones. I may have missed one or two, but yeah, those are the main rotations you're going to have. Um, they may be organized in a different way, but it's still going to end up being the same rotation. So before you even go to the hospital, you're going to have to learn a few nursing skills at your nursing school skills lab. So you'll be taught how to do your blood pressure, how to get respiratory rate, oxygen saturation, temperature from the different routes. You'll be taught, let's say you're doing blood pressure, how to place the blood pressure cuff, how to know which blood pressure cuff size to use for the patient's arm, and what to listen for when you're doing your blood pressure. You're also going to be taught how to do a complete head-to-toe assessment. In addition to the history that's gathered from the patient, a complete head-to-toe is one of the main tools that healthcare professionals have to gain an insight into what's going on with their patients. So it's always good to do a really thorough head-to-toe assessment because that's going to help down the line with diagnosis and treatment. So you're going to be taught how to do a complete head-to-toe assessment, how to do your heart assessment, what you're listening for, what's normal, what's abnormal. Same for the respiratory system and your GI tract. For my school, we had mannequins where we could listen to normal versus abnormal heart sounds. So I'm hoping that most nursing schools have that, because to me that was really great to listen, because the nursing students are going to be healthy for the most part. So if you want to just focus on or learning based on what you listen from your peers, you're never going to be able to hear some of those abnormal heart or respiratory sounds. So if your school has a mannequin, that's really going to be good for you to practice and be able to distinguish the normals from the abnormal sounds. You're also going to be taught how to transfer the patient, be it turning the patient in bed or transferring the patient to the chair and back to bed. You will be taught what posture to assume, because the posture matters a lot. If you don't assume the right posture, you're going to end up hurting your back, and that's going to affect the rest of your life. So make sure you take that really seriously. Know what posture to assume when turning or moving your patient. You'll be taught how to clean the patient while they're in bed. You'll be taught how to insert IV catheters, how to insert Foley catheters, and also how to measure your intake and output for your different patients. You also have a lesson on medication administration. So they will teach you the three patient identifiers to look for when you're doing your medication administration. So, and that's very important, because if you don't identify your patient, you may end up giving the wrong patient someone else's medication, and that, of course, going to have some adverse consequences on your patient and also on yourself. So you're going to be taught how to identify your patients, how to administer PO, so oral medication, IV medications. You will be taught how to crush medications to give to your patients who cannot swallow. There will be patients who only get nasal NG tube medications or G tube medications. So you should know how to crush your medications and prepare your medications before you administer them to the patient. One important thing about medication administration that you also be taught in your skills lab is how to do your dosage calculation. So doctors just know what dose the patient is supposed to get, but they do not always know what dose the pharmacy carries. So they just go ahead and put the orders for what dose a patient should get, but that may not necessarily match what the hospital has at their pharmacy. So the pharmacy is going to send what they have available. You have a doctor's order, but they don't match. So it's left to you to do your calculations and know what or how much medication the patient needs. So if the doctor says the patient needs 1,000 milligrams of a certain medication and you only have 500, then you know you're going to give the patient 2 tablets to make the 1,000 milligram dose. Now, once you've learned all these skills, actually at every level, so once you do your vital signs, you're going to be tested and make sure you have those skills down. Once you do your medication administration, you'll be tested, and also for your head to toe. So by the time once you've passed all of those levels, then you're ready to go to the hospital. Now, at the hospital, before you even get to your floors, you're going to get a hospital orientation. So, they're going to assign somebody to move around the hospital, showing the students the different areas. So, maybe the x ray room, the MRI room, the cafeteria, different areas in the hospital, and also the different nursing floors. Just so you know your way around when you come to the hospital. The hospital staff will also help you to get your ID badge, which also doubles as your access into certain restricted areas at the hospital. So they will help you get that situated. And then once that's done, you're gonna have a mini class where they'll teach you how to work their electronic medical record. So a lot of hospitals, if not all, have transitioned to electronic medical records. So they want you to be equipped with the knowledge on how to work their system before you go to the floor. So you're gonna get that class. They'll show you where to or how to access patient information, how to document your vital signs, your intakes and outputs. They'll show you all of that to prepare you for once you're on the floor. Now, once you're done with the hospital orientation, you're also gonna get a floor orientation. Now, it may not be necessarily be done by a hospital staff. It may be done by your nursing instructor. So they'll take you around the floor, show you the patient's rooms, show you how to manipulate the patient's bed, the bedside table, show you how to answer call lights and how to turn them off, show you the supply room, just different things around the floor, introduce you to the nursing staff, the manager, and also in my case, I believe we had the opportunity to work with their vital sign machine because once you get on the floor, it's go, go, go. So they want to make sure that at least you know how to do your vital signs because that's one of the things you're going to start doing once you get on the floor. Now, once your floor orientation is done, if you guys have time before the end of your shift, you may be assigned to just shadow a nurse for the rest of the shift, just so you get a feel for what nurses do and maybe ask a few questions. For the daily schedule, it may differ depending on what rotation you're at. And also, they may have to assign you to different or specific areas. So, for example, if you're doing an OB rotation, in my case, we had labor and delivery, we had the nursery, and we had the postpartum. So, when we came to the floor, you're going to be assigned to one of those areas. In psych, we also had days where we had to do presentation to the patients. So that's going to be incorporated into your daily schedule. But in general, when you come to the floor, your nursing instructor is usually going to be there already. They have to come in early to get the patient's list and assign them to the number of students that they have on schedule for that day. So once you come to the floor, they already have the patient assignment ready for you. You pick up your patients and then you go get report from the nurses that were working the previous shift. So you have to participate in that nursing report just so you have an idea of the patient. And then usually the nursing instructor will ask you to report back to them, just to give them again just heads up or just a summary of your patient's medical condition and why they're. After you're done giving your report to your nursing instructor, he or she may ask you or tell you what things they expect of you to do that day. Now, for the first few days, they don't expect a lot from you. So they may say just help around, answering call lights, helping the patient with their breakfast, and interact with the patient. Now, the rest of the rotation, they may tell you, okay, do your physical exam, do your eyes and O's, blah blah blah. They'll tell you what to do, and then once you're done, you come back and report that information to them. As the days go by, once all the nursing students are comfortable doing their physical exams and reporting their nursing findings to the nursing instructor, then they're going to start assigning a student a day or two students a day to do medications. So when you assign to do medication, once you get your patient assignment, you get your report, you have to tell your nurse that you're going to be doing meds for that day. So they know the drill already. They know you're going to be supervised, so they're not worried. But you just have to let them know so they plan their schedule, that they plan their day accordingly. And if it's your day to administer medication, you look up what meds the patient has that morning or afternoon, depending on your shift, and then you go report to your nursing instructor. She's going to take you to the med room where you pull out your medications and go administer them to your patient. So that's going to go on for pretty much all the rest of your rotation. You go in the morning or afternoon, beginning of your shift, you get your patients, you get report, you do meds if it's your day to do medications, and then you're going to report momentarily to your instructor. The instructors usually walk around the floor checking on their students. They are nurses too by profession, so they know what they're doing, they know how to help the students during their rotation. And then at the end of the day, you're going to be required to do a nursing care plan, which you should have already been taught in class. So every day, I think you're required to do a nursing care plan, and you're going to notice that you're going to progressively become better. So don't stress it up the first few days. Your instructor is going to give you feedback on your nursing care plan, but as the days or weeks go by, they expect you to get better and become a pro at the end of your rotation. So that's all I had for today. Thank you for watching. Please don't forget to subscribe if you have not already done so, and like and share this video. And until next time, bye bye.